Thank you so much. So a lot of the questions that Americans have about other countries' health systems, especially those that are single payer, have to do with accessibility of services. And the story is that in these other countries, people wait a long time to get to see a doctor or to get admitted to a hospital, especially around elective procedures. Could you comment a little bit about waits in your systems for routine and non-routine care?
So in the National Health Service, we have national targets for waits, and there's an 18-week wait for elective surgery, and the target is, I think it was 95% of people should wait no longer than 18 weeks. We have not achieved that target. It's in the 80s. But that's certainly a lot better than it used to be, I would say 20 years ago, where we had no targets for elective surgery. We also have maximum 2-week waits for cancer referral and cancer care. So these are very strictly monitored and checked upon. And so I think relative to where we were, we are doing a lot better. But that's the situation. Not also forgetting that in the UK, you cannot take yourself off to a consultant straight, like a specialist. You can't just directly refer yourself. You have to go via the general practitioner. So I would say that that's the order of weight in the UK. It's certainly not years, although there are some very long waits, but there may be particular reasons for that.
Yeah, a bit the same in the Netherlands. We also have a system where you have to go through the primary care doctor, so the GP first, before being referred. Generally, you can get an appointment with the GP within 1 or 2 days. For specialist care, we have norms around 6 to 8 weeks, depends a little bit on the condition. Oncology is also around 2 weeks. And those are monitored. And yes, we do have waiting list for some specialists, but generally accessibility is quite good.
That's one more thing.
Yes.
So sorry. Another aspect of access is not waiting. It's actually whether there are certain services that are just, you can't actually, that they are rationed in some way or more obviously rationed. And I think there are some areas such as, I think you mentioned dental care, where it is, it's very, very difficult at the moment to find an NHS dentist. It's almost impossible. So dentistry is one area. Obviously, optical care, optician care, that's another area which is, there aren't free eye tests any longer, and something called continuing health care. That's where care is on the margin of nursing stroke social care. Social care in Britain is means tested, which you have to have a certain level of income above which you simply cannot, or a certain level of assets, you cannot access free or at least government-funded social care. So some things on the margins, also cosmetic surgery, we obviously don't offer that blanket on the NHS. In vitro fertilization, there are some limits as to how many attempts you can have. So that's another aspect of access. That's true in every health system, but just to say that's made explicit, it's explicit for all.